it up for us, or we can call. I said you can never go away, ever.
I didn't know.
Oh, is this working it online?
I found it in CFR 26.
Welcome to AT&T's
I found it in CFR
conference
26.
service. Please enter your access.
Yeah, no, I did. Yeah. It's excluded from the
Join the conference. Please enter.
affordability. Yeah. Affordability is based upon the non-tobacco premium.
Participants on the call, including you. You are joining your
Based upon
conference
the
as the host.
proposed rule as
Available
of
commands. Press *#.
Good morning, everyone. My name is Damon Haycock, Finance Research Officer here at the Exchange. I want to welcome everybody on the phone and who showed up in person to our May 15th carrier onboarding meeting going over public education to include branding, marketing, and outreach and an advertising campaign. With me is CJ Bowden, our Communications Officer, who will be providing this presentation to everyone this morning. We also have Chad Hogan, and if you want to introduce your folks.
Sure. From the Choice Xerox team, Chad Hogan, Steve Huynh, Eileen Reba, and Shane Gruchow is here as well.
Before we get started with our presentation, I just want to take roll. If I can have one individual pipe in from each carrier who's on the phone right now. Please go ahead and start, and I'll repeat your carrier name afterwards so you know I heard you.
Hello, this is Anthem.
Anthem.
Nevada Health Co-op.
So I heard the Nevada Health Co-op.
UHC Nevada.
UHC Nevada.
St. Mary's Health Plan.
St. Mary's.
Coventry Healthcare.
Coventry.
Liberty Dental.
Liberty. We have anyone else? In the room we have the crew from Hometown Health.
And Jake Sunderland from the DOI. Good morning.
All right, before we get started, is there any questions that you want to bring up before we go through our actual presentation? If it's on the presentation, I would request that you wait till the end, and perhaps CJ will answer them during his actual presentation process. All right, with that, I'm going to hand it over to CJ.
Hello, CJ Bowden, Communications Officer for Nevada Health Link, Silver State Health Insurance Exchange. I'm going to start first on the media presentation dated May 1st, 2013 that you downloaded from the website. What we're coming up with is we've done a lot of research and we're looking at putting the Nevada Health Link name out there and educating the public through a multifaceted marketing and advertising campaign. All of our placements are research-based. Again, we've picked the name and the logo through focus group testing, and a lot of research has gone into those. We're going to utilize a mix of media to address our target audiences with effective reach and frequency. The goal of Nevada Health Link is to have 83 or 84% of our eligible population hear our message a minimum of 24 times. So that's the goal of the marketing campaign. How are we going to achieve that? We'll move on to the next page, which is media mix. We're going to go through television spots, of course, commercial television and time slots that fit our target market. TV is the most intrusive medium. It creates impact by bringing advertising message to life unless you have a TiVo, and we do understand that. There's a lot of skipping and television skipping, so we're really concentrating those primetime first-run shows where people will watch the entire show to see the message, and live sporting events, because a lot of people are in watching the live sporting event to see it at that time. They don't record a lot of those for later. We're going to do a big digital media campaign. The digital media is going to be point to click and targeted towards those websites and those audiences that we think are in our FPL levels. So when they visit a website, there's going to be banner ads towards the side, and it gives us a greater reach and ability to hit that target audience than just buying television programming. And then radio, we're going to concentrate on some of the talk radio. We've got a mix in the back of our target audiences and what they are using. We're going to go to the next page. Out-of-home advertising, we're going to do quite a bit of out-of-home advertising, including bus stops, billboards, and posters in locations that our target audience uses. Print, we're going to go a little bit of media in print. It's not our largest because of the expense and because people don't do that. A lot of the print will concentrate on our business-to-business campaign and those business customers that use that medium. Let's go on to page 5. Our audiences, of course, we're aiming directly at that 138 to 400% FPL. Hispanics 18 to 54 in age range. Younger families with children 18 to 34 in age range. And then young adults, primarily the young invincibles from 21 to 29 years of age. Moving on to page 6. Our objective is to generate greater awareness about Nevada HealthLink in phases 2 and 3. This is a very interesting marketing program, and from a marketing and advertising standpoint, this isn't a product launch that we can measure by effectiveness of enrolled individuals. There are many things in this product launch that Nevada HealthLink doesn't control, including price point of the product and the income level of our target audience. As that income level goes down, they may make decision purchases that are different from that. That's why we're going for a reach perspective, so that the Nevada HealthLink will put out the message of where to go, when to find the plans, and how to enroll in the plans on a basis where 84% of the people will hear it 24 times. We want to surround our target audiences with a mix of traditional and non-traditional media. At our end goal, our objective is to enroll 118,000 people in Nevada HealthLink for the first open enrollment period. So moving on to page 7, our strategies. How are we going to do that? Of course, develop a plan with the greatest reach and frequency within our allocated budget. We have a budget of $5.5 million, and we're using that budget to its fullest extent. We're going to use paid media to clearly communicate and control the message content, timing and placement in various outlets that are targeted to reach our specific audiences, and we'll get into that a little bit more in the next pages. On page 8, moving on to 8, we're looking at our campaign to start on July 1st. You're going to hear radio and television ads starting on July 1st, as well as seeing outdoor and billboard ads starting on July 1st. Another part of our marketing campaign that we're doing is a public awareness factor. It's not stated in the media plan because it's not direct broadcast media, but it's outreach media. And we are currently, starting in April, we've gone out to different community events, outreach events, Cinco de Mayo festivals, etc. We have approximately 124 scheduled through the first open enrollment period to go to the events and hand out in person and speak to in-person people. Since we've started that approximately 30 calendar days ago, we've reached over 4,000 individuals with conversations. So with our messaging waves, of course, we're going to start from July to September with education and awareness. What is Nevada HealthLink? How do you use Nevada HealthLink, and what will it give you? October through December, open enrollment, we're going to go, we are here, it's here, enroll now. Enroll before December 15th for coverage starting on January 1st. That's going to be the main messaging in that segment. And then starting in January and moving to March, we're going to increase the enrollment message and the urgency behind that message to enroll before March 15th, or you're out until the next open enrollment, to try to pull those people in. We're going to start this out because it's a complicated topic. We're going to start it out with 60-second TV spots to launch each wave, and then we're going to rotate into a 30-second spot to deliver and sustain the message as it goes through. So those 60-second spots will go over and tell about Nevada HealthLink, or maybe tell a consumer story that did not have health insurance, what it would have done for them to get people aware of the benefits of having health insurance, and it'll get our brand and messaging out there. We'll increase the intensity for the first 2 weeks of December, for the December 15th deadline, and then again in March. The first 2 weeks of March, maybe even the third week, we're going to increase the density of those ads out there to drive that last enrollment. Some of the latest research numbers that we saw that came in said about 20 to 25% of the people waited until April 15th to file their taxes. So if we look at that same thing, we want to be there at the very end to help push that same segment along. Moving on to page 9 on television, some of the stats that we have here. Over 84% of the target audiences watch TV. Of course, Las Vegas, Nye County, Lincoln and Reno Sparks, Carson City, Elko, Gardnerville, Winnemucca, and Fallon. That's really where we're going to concentrate on the television media. That's where those population centers are based and those markets that we really want to hit. Again, I talked about the 60 and 30-second commercials, how we're going to phase in. And cable. It's interesting, through our research, we're going to concentrate our cable advertising on those networks that are displayed, Adult Swim, Discovery Channel, etc. And we found through the research that we've done that we could deliver approximately the same message if we advertised in English only, because there are English speakers in the household, but we are going with a full English and Spanish advertising campaign to hit both markets. And then we're going for added value spots, of course. These are things that different agencies or media outlets throw on top of your media buy to help that partner community events with radio stations, have people show up, have their radio station mascot there, do some awareness there, public service announcements, and then, of course, interviews and news stories. Moving on to page 10, spot programming. Where are we going to advertise our message to reach? When we laid out the grid of what our target audiences watch, you can see a lot of similarities there. So on our local affiliates, that's ABC, NBC, CBS, Fox, we're going to go through the 5 to 6 local news programming spot, and then hit the primetime shows like we talked about. These are first run shows that people tend to watch and don't tend to record. So that's where we're moving into. You can see some of those on there, and where we're going to advertise to reach the Hispanics, young families, and young invincibles. And the nice thing is the sports segment really resonated across all, so we're going to get a greater reach for those marketing dollars. Moving on to page 11, we have digital media. We have over 90% of our target audience has internet access, so it's a very good way to reach that audience, and over 50% of our audience spend 1 to 9 hours per week on the internet. We're going to use the traditional display and banners, etc., and flash video. We're also going to do some pre-roll, which is online commercials that play right before the news stories come up. If you're looking at the news, it's an online commercial that comes up that you have to watch before your news story plays. Very intrusive. I don't like them, but it gets your message across. Then mobile tablet, we're working on designing the ads so that they will display well on both mobile and tablet type computers. We don't want to have an advertisement display half or not display correctly. We want to make sure everything's conducive to the mobile environment. Pay-per-click, we're really not looking at using pay-per-click because of the insurance industry. It's a very competitive, and it can run from anywhere to $20 to $30 for a pay-per-click to drive each individual member to a site because of the advertising and the way it's laid out. Social media, we're going to be on both Facebook, YouTube, and Twitter. YouTube, we're going to do some organic videos from the ground up using staff, not using professional paid actors. We'll have Mr. Haycock acting in some of those and explaining Nevada Health Link and the things that go along with it. These are going to be linked to other media that we have. You can go on, look at the YouTube, and it's a very cheap and effective presence on the internet, and we can get our message out there.
Never mind, I'm sorry. I'll give him a hard time later.
Okay.
And then our categories that we're looking at is the overall uninsured and Latino uninsured markets. On radio, we found through research that 73% of our target audience listens to the radio. We're going to use 60-second radio spots placed on the top stations to reach our audience. That's the message that we're going forward with in the strategy. Of course, we're going to go for the same type added value, but in radio you can get quite a bit more added value with interviews and news shows and medical shows that want guest speakers on them. So we're going to be doing that and putting guest speakers on these different programs to get the word out about Nevada Health Link. Moving on to page 13, it shows the Southern Nevada radio stations that we're going to advertise on. There's some nice cross in between the different segments. If you look at that, the Young Invincibles also include Hispanics. When you look at the cross and see that Mexican regional radio is rated in the Young Invincible market, that is because there are Hispanics in the Young Invincible market. There is a cross section to all of these. There's also Hispanics in the Young Families market and, of course, the Hispanic market. But we have found in most of the Hispanic radio that the different radio stations are divided into segments. They do 1 hour shows, and then another host will come on and do another 1 hour show. And that audience truly listens to this station for 1 hour. They'll turn over and listen to another station for 1 hour and back and forth, especially during the workplace. So we're going to advertise in specific 1 hour spots that will hit the audience that we're looking for. In Northern Nevada, again, a list of radio stations that we're going to be advertising on. I don't want to go through them ad nauseum. We'll go to page 15 and go to the out-of-home marketing that we're going to do. Of course, we want it geographically targeted. Las Vegas and Clark County is a little bit harder to geographically target your audience because you have neighborhoods butting up against each other with very different income levels. But in the high-density Hispanic, this says low income zip codes, and we've made a change from there because we are not truly after entirely low income individuals. We're targeting that 138 to 400% population that's eligible for APTC credits, and we're going to move it from a low income neighborhood into your middle income neighborhoods as well. And then high traffic areas that you get the greatest frequency, again, the I-20 or I-15 corridor in Las Vegas. We're going to be hitting that very hard, in the I-95 in the Spaghetti Bowl down there. Event advertising, we're going to be advertising with the Las Vegas 51s and Reno Aces, local sports teams, and we're going to do programs with the colleges as well. We're going to really try to concentrate on the digital and poster panel billboards to get a greater reach, and maybe have 2 ads on that flip to have people not see the same thing over and over again. Moving on to page 16, our print media.
Can I just ask a question?
Go right ahead.
Is there some reason why you're not targeting the 50 and over retired, underinsured, who might be at the poverty level by, I understand, I've just come from another meeting where they're talking about there should be an attempt to solicit not just people that are subsidized, okay? And then I apologize, I roll into this one and I see that the target population is primarily the subsidized, and that the radio stations that you're talking about using are not the ones that where people who might really need insurance would have. So for the sake of argument, when we look at our current individual plan and what's signing up and sending in applications for our individual plan, it's primarily people, literally at the 45 to 65-year-old level who are anxious for coverage. So I'm just asking, is that part of the target market for the exchange, or is it an expectation that that level of risk will be in the non-exchange market?
We're looking at that. That is definitely part of our target audience, and we really want to address that. But the nice thing that we have found through our research, and why I didn't include it in this presentation, was that population that you're speaking to, those 45 to 60 individuals, are educated, they are anxious to receive coverage, and they do a lot more looking on their own to find the best coverage options for them. We're going to have spillover from each of these target markets and each of these advertising. They're going to spill over both into the Medicaid eligible population, and it's going to spill over into the over 400% population, especially our sports viewership and our primetime viewership. They just weren't listed as key opportunities that we were going after because a lot of them are in the very concerned health insurance purchaser option or category, and they are doing a lot more looking for coverage than most of this target audience that we're addressing. We wanted to stretch our marketing dollars as far as we could and reach the greatest amount of people. Back to page 16 on print. Just to reiterate, we have 40% of our target audiences that read printed paper on a daily basis, and this is very effective in the rural markets. We found, especially in the Elko, Pahrump, and Humboldt areas, we're going to be advertising quite a bit with the newspaper moving in, and then the Hispanic and minority placements are very important for the printed population. They get a lot of their everyday news from the mainstream channel and then go to their the paper in their own language to verify or look to see if those products are there as well. And we've looked at something that's a little bit different, but in the job-related categories, people looking for jobs are looking at just placing classified ads in there for Nevada Health Link. If they're out there looking for a job, or if they're looking to change job, maybe for benefits, they can look and see our product in that same location. So we're looking at those different kinds of opportunities as well. That, in a nutshell, is our media plan, excluding the outreach. I have an entire outreach plan that we go with. And you'll see in this plan, this is to drive awareness and drive our message to enroll. Where, how, and when. With carriers, we didn't have any carrier-specific advertising placed in any of these, and we felt it would not be the exchanges or Nevada Health Links. It wouldn't be very good for us to advertise with a single carrier because it would look like we were endorsing a carrier. And we didn't want that perception out there. We wanted to be a fair and open marketplace. So we were advertising Nevada Health Link as a brand and a place to come to get health insurance coverage. So we can look into the future if we have all plans after they're certified and after the information is released by the Division of Insurance on the people that are participating. We would be more than happy to look at putting together a joint advertisement that would take care of all carriers. This is Nevada Health Link, and if you're looking for insurance from this entire group of carriers that have offered plans on the exchange and have your logos or things in a commercial like that, we'll definitely look at doing that after plan information is released from the DOI. But everyone would have to be on the advertisement at the same time so that it's equal opportunity.
Well, what about the advertising we buy? Can we put out an ad that says, Hometown Health, your friend on the exchange?
Okay, now that is advertising on the other side. So that concludes the media presentation.
Well, I had a couple questions.
Oh, absolutely. I'll take all the
About your
questions for
goals?
media. Yes,
You said 84% would receive this 24 times. Is that over the whole 9 months?
that is over the entire 9 months, yes.
Okay, and how are you going to measure that?
We've done a pre-survey in our June board meeting. We're going to give the pre-survey results out that we've done with applied analysis out of Las Vegas. We did a survey that went over internet and telephone, reaching that target audience. We'll go through the methodology in that June board meeting, but we've measured the number of people who know about the ACA, exchange programs, if Nevada has an exchange, and we've measured that in different responses. So we're going to give a very detailed briefing on that in the June board meeting and the results of that survey. Then we're probably going to do a mid-panel survey right in the mid-time about December to find out where our effectiveness is there. We may move that back towards October. And then post-campaign in March, at the end of March, we will do another survey and measure those results on those 3 surveys to make sure, and the third party's doing the survey, making sure everything is documented and the people that they speak with, income levels, everything.
Okay.
Thank you. Say thank you.
Thank you.
Tell the boss this way.
The broadcast ads that you guys are going to have
Yes.
displaying, are you going to put them online or share them so that those of us that are interested can see what you're putting out there at that time or before, so that we don't have to try to sit there and watch every one of those TV shows without TiVo?
Absolutely. And what we would like to do once we produce those and once they air, we want to get them on YouTube. So a person that comes to our site can go to YouTube, see it again, get the information again, and try to push that out there virally. Hopefully make sure that it goes through virally with Healthcare Exchange. Hey, I like that. But make sure it goes through our target markets, and we'll have them on our website, NevadaHealthLink.com. They'll be on exchange.nv.gov, and we'll have them on YouTube.
Great.
Do we have any other questions or any questions from the phone on the media presentation? Okay. Hearing none, I would like to move into the brand standards guide. This would be the Nevada Health Link brand and use of the logo and name. Our brand that we've come up with, we've done that through a lot of research, and it represents the core of Nevada Health Link, and this will be the thing that all consumers see during all of the branding. As you can see, I mean, even I have the presentations branded with this. All of our PowerPoints that we're delivering are branded with this message, and we're going to continue with this logo tagline for the rest of our existence, unless the board decides to change that.
And for those of you that are on the phone, it was the actual brand standards guide is not designated in as one of the presentations under our presentation section of the carrier onboarding page. It's actually its own Nevada Health Link brand standards section. So if you're trying to follow along, you don't have that document. It's linked right there, brand standards guide on the carrier onboarding page, so you can follow.
Perfect. Thank you, Damon.
But the document is not opening up on the.
It will. Please give it just a minute, and we can take about a 30-second break. The internet was very, very slow this morning, even for us to open it.
It's a massive document. It's very colorful with large files and large pictures. So we'll wait a few to get it to open. It takes sometimes a couple minutes on our computers just to open up.
So I'll start talking about a few things, and then if there's questions on the telephone, we can always go back. Starting on page 4 of that brand standards guide, you'll see the logo we have at the bottom, Nevada Health Link, and our symbol. This breaks it up into 2 different sections. One is the symbol, and one is the logo type. So they can be displayed separately or as a full. There's just a geometric breakdown so that you can get the shape patterns of where we're at, where the things lay out on the next page, which is page 5. Moving on to page 6, we have primary logos. We have them with and without taglines. We have them in English and in Spanish. And those are representations of them with the colors. Moving on to page 8, we have secondary logo options. If you're putting together a coverage card or a evidence of coverage card and printing the logo on it, if your card has a back color on a card, if it's blue or if it was black, then you could use the reversed out color logo instead of the 4-color logo. And we have colors in here that we specify, but white is our best option for reversed out color. We'd like to stick with that when the logo is used on a colored background, or we have the 4-color options that are below both of those, and those are on page 9. Moving on to page 10, we have clear space requirements, and it's not a lot of clear space, but the N in Nevada, the lowercase n in Nevada, is the clear space requirement. So whatever size that logo is at, we'll get into acceptable sizes here on the next page or two, but whatever size that logo is at, that N is the acceptable clear space surrounding the logo when it's placed on a presentation with your materials or on an advertisement with your materials. Moving on to pages 12 and then 13 is logo minimum size. The minimum size that we can display the logo in and the minimum size that we will allow it to be displayed in is 1/4 inch. That's shown on the upper left, and that seems to be what most evidence of coverage cards are in. Not the primary carrier, but the secondary information on there. I checked our cards that we have currently, and they're all in 1/4 inch or larger. So we have a 4-color option, and as I said, you can do a 1-color option as well if you're only printing a monochrome, but it has to be in one of the approved colors that we have. Moving on to pages 14 and 15, this shows examples of improper logo usage. We don't want to rotate the graphic, especially when it is with the Nevada Health Link name, when it's with the logo. It has to be maintained with the purple or magenta on the upper right hand side. And the second one would be do not alter the relationship of size. We want to keep them just as we've stated in our brand standards guide. And then we do not want to print Nevada Health Link without the logo. The symbol can be used separately on its own, but Nevada Health Link cannot be used without the symbol. Of course, don't change colors. That's kind of the red there. Please don't distort it, pulling it out either vertically or horizontally. We don't want to change the positioning of the logo type to make it fit your application, or change the font type. We're happy to provide the logo to every carrier participating on the exchange, and we're happy to provide the correct font types that go with the logo. In the middle at the bottom, please don't add graphics to our logo or change the relationship of the wording, moving the symbol on top of the words. And then the very bottom row shows 3 examples of fade out or bleed out. Please don't use a background that's too light if you're using the white logo, or a colored background if you're using the colored logo that bleeds out and you cannot see that color logo on, or a picture where the logo is lost in the picture. So that kind of goes over our incorrect, those are examples of incorrect usage, do's and don'ts with the logo. Taglines, moving on to pages 16 and 17. The taglines, we have connecting you to health insurance and para nuestra salud, nuestras familias y nuestro futuro. Those are our taglines, and we have examples of the 2 logos, or excuse me, the 2 font types that those can be used in on those. So we have examples of usage, connecting you to health insurance, enroll October 2013 through March 2014, and the same with the Spanish tagline. We have our primary typefaces. Those are Whitney, Light, Book, and Bold. If you, as I said, if you do not have access to those, we're more than happy to give you a download of those so that you can have them on your systems to use. Moving on to pages 18 and 19, these are secondary typeface in the logo and alternative typefaces, but if it is not listed in the brand standards guide, it cannot be used to display our logo. We have these typefaces for a particular reason, having it easily identifiable and easily read. Moving on to pages 20 and 21, we have the colors of the brand, and this goes through all the color variations for each of the logo types, breaking them out all the way down into your cayenne, magenta, yellow tables so that you can get the correct colors on those. If you're using a multicolor logo with fade in, such as the one that's displayed on page 21, then it shows you the different gradients that we have as well. Page 22 is the other side of our logo, and then we have call outs for the specific colors, the purple, green, blue, yellow, dark gray, and light gray that are used in the logo on, I think it's page 23. Moving on to page 24, our symbol is a important part of our brand identity, and we use it on all of our pieces. It is a geometric layout there of the symbol that we have and the correct orientation with coloring. If we move on to page 26, this shows acceptable use and acceptable cropping of using the image solely or the symbol solely. If you want to use that on any of your advertising, because we're going to have it out there as well, you can use that in those following formats. You can rotate the symbol alone, you can crop the symbol, and it shows the way that those can be done.
But you can only rotate it if it's cropped. If it's uncropped,
If it's uncropped, it has to remain
the magenta upper right.
magenta upper right, yes. And then imagery that goes along with our brand when you're doing the advertising that we want associated. You can see the bright pictures, pictures of health, sunlight, outdoors, and family. These are just examples of pictures that go along with our branding and our brand family and what we would like to stick to. So in other words, no dungeons with chains in the corner and our little health link chained up on the side. We would not prefer that.
No tumors.
No, right beside tumors and those types of things, or yes. That concludes an overview of the brand standards guide and the media presentation. I'll be more than happy to answer any questions that go along with that. I guess one more final thing to point out would be we're currently in the process of completing a document or a policy for use of advertising of the Nevada Health Link logo, and we'll get that out as soon as possible. But what that is who can actually use it. Of course, everyone seated at the table and on the telephone line is a carrier that will be participating in the exchange and Nevada Health Link, and you'll definitely be able to use it in your advertising, especially for those products. But if it was for an ancillary or a customer of yours, if somebody, we'll use John's example, if somebody had a customer of the Mustang Ranch or the Moonlight Bunny Ranch and they wanted to partner that with Nevada Health Link, they need to go through us first and get approval for use.
So, we're talking about carriers, but what kind of guidelines you can have for brokers?
We need to develop those.
That's what we're developing.
Yeah, I think that would be important.
Mm-hmm.
So in terms of the marketing guidelines, is this just for marketing if we choose to use your logo?
Yes, I mean, I think the only requirement for use of logo for carriers is on the identification card, the insurance identification card. But other than that, if you choose to use our logo, if you want to partner with, as it was brought up, if our partner with Nevada Health Link is this product, then this is how you would use our brand and logo.
Yeah, so we would expect that if you are doing advertisements and you are offering plans on the exchange, by all means, say, hey, plans available on the exchange. If you decide not to offer plans on the exchange, we'd have to think about it, but probably would not let you use the logo if you're not offering products on the exchange. Although I assume that if you're here on the phone, your intention is to offer those plans. For the brokers, again, we have to figure that out. But I imagine that just looking ahead, we would probably say that if you have come to the exchange to sign the agreement and get your login, that you'd probably be able to use it. Exactly how you can use it, though, is another question. We're trying to figure that out. So we will try to get that information out as soon as possible.
So it is mandatory on ID cards, but in terms of marketing, it's our choice. How about other materials like welcome packages, summary benefits, evidence of coverage? Is that still just our brand logos, or?
I mean, we, of course, from a marketing standpoint, Nevada Health Link would love to have you put our logos on those materials as well, especially if they're products that are sold on Nevada Health Link. But that is completely up to the individual carrier.
We also understand that you may be offering those products both on and off the exchange.
Right.
And so if you want to have that dichotomy, the difference between those two, we can understand that. So again, it's not required. It's not required on those plans, but if you want to put it on there, if it's offered on the exchange, by all means, go ahead.
Great. Perfect.
This is Lisa Kelly with Anthem. I just have a question. So if we have communications to members, like for instance, I'm just making this up. They send us in a request to make an address change, which needs to go through the exchange. And we send them a letter back indicating that they need to contact the exchange to make those updates, and we provide them with contact information and those types of things. Would we need branding or anything like that where we're referencing them to contact you or anything like that in some of our letter content?
It's not required. You could just type out "Contact Nevada Health Link" in whichever font that your company uses. You would not have to use branded materials for that. Everything that comes from the exchange, notices that come from the exchange, and invoices that will come through the exchange or from the exchange will be branded, and they will have our logo type on them.
Yeah, so like that font size, the font types that we were talking about, if you say in your text, available on Nevada Health Link, that's in whatever text that you are using. But if you use it with our symbol, with the symbol itself, with the logo itself, then that should be, in that case, the text should be the appropriate text.
Correct.
Okay, thanks.
Mr. Sunderland?
Yeah, I think it's already been addressed, but I just want to confirm I'm understanding. Policies that are sold on the exchange, the ID cards have to have the logo and the branding on it somewhere?
Yes.
Okay, thank you.
And it has to be a 1/4-inch high minimum with minimum clear space around it. And it's the carrier's option whether they want to do it in full color or in monochrome, and we have those approved monochrome colors on there.
And does that have to have the tagline as well, or
no?
At a minimum, the chain links.
The chain links and the Nevada Health Link.
Okay, thank you.
Any other questions? All right.
You don't care whether or not it's on the front or the back of the card?
No, we do not.
Wherever you can find space.
That's all I have for the brands. I'd like to hand it over to our executive director, John Hager. He has some items he'd like to go over.
So just a couple of items that have come up over the last week, and I think we may have sent out maybe one of these in communications. I'm not sure yet. Off the topic of branding, but my understanding is that because of the single rating pool, carriers are required to submit all plans together because of the single risk pool. So whether that's on the exchange or off the exchange, so please be aware of that. If you're concerned about that, please contact the Division of Insurance. But I think the latest guidance is that all plans that you offer, I guess, with a product would have to be submitted at the same time, which is June 7th, which is quickly approaching. So we got 3 weeks left. If you need any type of assistance, we will help you as we can. I believe we're setting up a webinar, seminar, discussion with the SURF folks. I know you've had a couple of those with the Division of Insurance, but as you get further into this, any last-minute questions, hopefully they will be available to answer that. Chad, do you have a date for that yet?
On the SURF call yesterday, we indicated we're still coordinating with SURF to get that put together.
Okay, but relatively soon?
Yes.
Within the next week and a half, hopefully?
I don't know why we couldn't.
Okay, it needs to be sooner because obviously they are running out of time. We want to make sure that you have that option. Also, there was discussion about tribal plans, the 100% actuarial value plan, and the question came up at the federally facilitated exchange, and then one of the carriers brought it to us. If you're going to submit a plan or a product, so you got the same network, you got the same items covered, everything exactly the same except for the cost sharing. So you got a bronze plan and a platinum plan. When you offer the tribal plan, you have to offer a 100% cost sharing plan. Those plans would actually be identical, except that the premium for the platinum plan would be more than the bronze plan. It doesn't make any sense to offer two separate plans that are identical at two different prices. We've talked with the Division of Insurance, and they said that it makes sense that you would offer one plan, one tribal plan, if they're otherwise identical. Now, they have to be identical. There can't be any differences in it. But basically, if you were to take those plans and make them 100% AV cost-sharing plans, so zero cost-sharing for the tribal member, if they are identical for everything other than the premium, then you would only have to submit one at the lowest cost plan. So if you offer a silver and a platinum plan, we expect that you would offer you'd only have to offer one of those at the zero cost sharing. But in that case, the silver plan, which would be the least expensive, would be offered. That will allow you to, if you have, say, four different plans that are basically identical, you got them at each of the metal tiers, and you only have to offer one. That means you basically have to offer those 5 plans rather than offering 8. And because we understand that the entering items into SURF has become very complicated and time-consuming, hopefully that will save you some time. Again, we want to encourage you to start entering those items into SURF. We have confirmed that at least 150 plans have been submitted into SURF and certified, so it is possible. Although we had recognized it's difficult. And we also, I believe I sent it on to our team to forward. I don't know if we forwarded it yet, but you will get a Q&A from SURF. Have we sent that on yet?
I think we're just going to post it on the carrier onboarding
Okay,
section.
so we're going to post that on the carrier onboarding site. It's an FAQ from SURF that helps you work around some of the issues, some of the difficulties that have been that have occurred in SURF. The other item with SURF that we've talked about, if you plan on age rating the tobacco surcharge, you can do so. The SURF system will not allow you to enter an age-rated tobacco surcharge with the rest of the plans. So our workaround is that you enter your plans without the tobacco surcharge, and then provide a supplement document using the same Excel file template, but as an attachment rather than a data entry. That way, the plan is not the validation actually will work when it shoots up to HIOS, but the Division of Insurance will still be able to check the rates to ensure that they are appropriate for consumers. So those are kind of our SURF updates. I know they don't quite go with brand standards guide, but I want to make sure you get the information as quickly as possible. And with the exception of the FAQ, I think everything else has been posted on our carrier onboarding webpage. So please continue to look there for the latest and greatest information.
This is Lisa Kelly with Anthem. With that supplement you were saying with the tobacco surcharge, would you then use that on the exchange to make sure you quote correctly and bill correctly?
Yes, that's correct.
Okay.
And also, this is Eileen Reba of Xerox. We sent out an email late last week with just some other places to get help. So the phone number and the email for the SURF Help Desk, as well as the CMS Exchange Support Center. So those are other options that you have for trying to get some assistance.
All right.
Any other questions, concerns, off-topic stuff? You have our contact information. If you have additional questions, please reach out to us. If you have got concerns, let us know what we can do to help.
The next meeting is on May 22nd, and it will be going over customer service, the customer contact center, brokers, and enrollment facilitators. We look forward to hearing from you and seeing you next week. Thank you, everyone.